further ado, let me bring Patrick on here. Patrick, good to have you here this afternoon, and I know that we're ready to get into what we're going to be talking about today.
Yeah, it's amazing how many people are showing up here on this webinar. I guess the draw of our webinars is that we try to give you information at no cost to educate you on the business, let you know as much about it as possible so that if it is right for you, that you can join us here at our live training workshops down here in Dallas.
Absolutely. Yeah, we had a lot of people that come pushing through here, some folks from Arizona and from California. And we've already got some questions that are coming in. So, Ron, we'll get to that question here in just a moment. But, no, Patrick, you wanted to just kind of talk with everybody just one-on-one here just real quickly and really kind of just let's discuss what we're going to be talking about today and then everything that's really particular about this particular business.
Good. I'm ready to get started. What's the first question?
Well, it looks like Ron's got a question here. I don't know if you wanted to try to take that question here. What is the success rate of new business starts with American business systems?
What's the success rate? Okay, let's see. First of all, let's see, Ron, if you could define success for me, that would be my first step, because when you ask what the success rate is, I need to know what your definition of success is. I've got licensees who've signed up one client, and they're thrilled with the income that they're making with that one client. Then I have others who've signed up hundreds of doctors, and they've just built it to a different level. They've opened an office, they've hired people. It's just a different level of success. So when you ask about the success rate, you're probably asking what the failure rate is. That's what people really want to know, is how many people fail. Well, the only way you can fail in our business, Ron, is to not do anything. If you take what we teach you in the week of training here home with you and you don't do anything with it or put it on the shelf like we've had people do. I just interviewed a licensee, three or 4 weeks ago, Eric, that did that very thing. Came through in 2009, stuck it on the shelf because he had a full-time job and he just couldn't devote any time to it when he got back home. But then after a few years, he lost that job. Now he says to his wife, maybe we should just get this thing going. So he did. Now he's got 15 doctors. So you can't fail in this business if you just go out and do what we teach you to do, because we've been doing this for 22 years. We got this down.
Well, and Ron's asking, yes, the failure rate if people fail. And Ron, I think what will help you to understand why we don't have a lot of failure rate is maybe get with the person that asked you to come here and have them do a demonstration of the software along with some of the other things that you'll learn about what our licensees actually do to actually get doctors. And I think that's what you're really asking, what happens if I don't get a doctor? So that's what you're asking. So we would love to be able to demonstrate that one-on-one with you. So get with the person that brought you here. Now, one of the other questions that I like to talk about, Patrick, is what are doctors thinking right now? What are they thinking? I know that there's going to be a lot of changes coming up here in the next few months, maybe in the next year, but really, just right now, what are these doctors thinking about?
Well, the feedback we get from our licensees and doing the research that you're involved in, of course, Eric, we have found out that doctors are thinking right now, why should I stay in private practice when I'm not making near the money that I used to make? So really, it's all about the money. They probably have dreams about, my practice is going to go under because I don't have the cash flow that I had, say, 2 or 3 years ago. And that's because of all these changes that have come down from the government, lower payments from reimbursements from the insurance companies and from Medicare. All those things factor in. So that's one of the reasons we wanted to talk to people today, is to show you that you can be the solution to that problem that the doctors are having with cash flow.
Well, it's interesting that you even say that because as we're seeing right here, I'm going to highlight some of this. Folks, you can see this is from Crane's New York business. It's something we just got off the internet just today, but this actually came in November the 6th. And look what the title of it is. New York doctors struggle to stay independent in a changing industry. Patrick, you want to kind of take it from here because it's almost like you wrote this, because some of the things that is written in here is what we're going to be talking about here in your book here just shortly.
Yeah, well, I'll just read the quote there. Doctors in private practice have always had to balance the demands of running a small business with providing the best care for their patients. But the challenges of keeping the waiting room open are growing amid declining reimbursement rates. There you go. Eric's underlining that. From insurers, because folks, those declining reimbursement rates are hurting the doctors big time. And then, of course, there's rising overhead costs and a torrent of new regulations that have come into play in recent years. So that includes, of course, what you mentioned earlier, Eric, that the Affordable Care Act, known as Obamacare, has caused the doctors to reduce, the time that they have to spend with patients because they're seeing more patients. More people have insurance now, so the doctors have to see more patients, so they have less time to spend with the patients. And, of course, that means that their care, the quality of care goes down as well. So it hurts not just the doctors, but us as well.
Yeah, there's no doubt. And even Dr. Ray Walker here, he's the one that actually does this particular survey with doctors all across the country. And just look what he says here. He says the fact that all of these trends are occurring simultaneously makes for a very turbulent times for the physicians. So, folks, if you understand what these doctors are saying, it's difficult for these doctors to stay and remain independent. They want to remain independent. Matter of fact, through the rest of this article, you would actually go out there and see what doctors are doing differently to make sure that they do stay independent. So, folks, it's an ever-increasing issues that doctors are wanting to stay in business, but they just don't know how to stay in business more independently. And the book that we're going to share with you here in just a little bit really addresses that.
Now, you probably heard this saying. I don't know where I read this, but a few years back I read something that said, the key to getting wealthy is to find a need and fill it. Right. But here's the need. We just pointed out the need to you guys, and here's another part of that need. Market analysts estimate that 24 cents out of every dollar are wasted on the administrative and billing expenses in a doctor's office. So you can go in and find that problem, that need that the doctors have with what we call a free practice analysis, which we've come up with and that we teach our licensees to perform. They're in the office with the office manager or the doctor. And you'll see, guys, that you can cut that 24 cents down to 6 or 7 cents out of every dollar. So you can save them money and take away that headache. Doesn't that doctor look like he's got a headache?
Yeah.
Probably because he doesn't have a face.
And this doctor's scratching his head.
Yeah.
And this another article that we got out of Physicians Practice. And this one's recently too, and does private practice is it still even attractive career path? I mean, I think it's a great article for us to kind of go about, because I know, Patrick, many people ask us, aren't doctors leaving private practice to go and get employed by hospitals?
Yeah, well, as this survey says, the physicians who responded are still positive about private practice ownership. The most telling finding is that it's not just current practice owners who are optimistic, but employed physicians see the upside to private practice careers too. So even those doctors who come straight out of college and go to work for a hospital or something, they see that they want to be, look, they're just like you and I. They want to own their own business. They want to be independent business owners. But as it continues here, for many of the employee doctors, they're not just positive about private practice ownership. About 20% said that they're considering owning their own practices in the future. So that's why this is a growth industry. Eric, I tell people this. Look, as long as there's human beings that get sick, and as long as we go to the doctor to get well, and as long as the doctor has to bill somebody to get paid, there'll always be a need for people to help the doctor with that. And that's
right.
What we teach people to do. Get that money from the insurance companies and from the government agencies for the doctor to take that off of their staff and save them money.
Yeah, and because, Patrick, you nailed it just right there. That's why doctors are trying to look for a solution. And right now, all these reports that are coming out that doctors are getting employed by hospitals, it's simply because they're trying to find a solution, and they feel like the only solution is to go back, maybe work for these hospitals.
Yeah.
But this is the best article that has helped us out here, even just recently, to understand that doctors don't necessarily want to go to be employed. They want to stay independent. And our licensees are filling that gap between employed doctors and independent doctors.
Well, in fact, Eric, as you know, we've heard from licensees who have approached doctors' practices, did the free practice analysis, found out where their leaks were in their cash flow, and solved that for the doctors. And the doctors have told them, I would have gone out of practice. I was thinking about shutting my practice down before you arrived. and we turned that completely around and got them another, you know, $10, $15, $20,000 a month. That will turn that around.
Yeah, no doubt. It certainly will turn it around. Well, today what we're wanting to do is pull all of this around. And obviously, folks, we know that you came here to learn how to start a business serving physician practices, and that's what we're going to do. But as you can see here, Patrick's new book is called The New Thriving Medical Practice. And so what we want to talk to you about is how you will be a new thriving ABS licensee today, and knowing how you'll be able to use all of the tools. You don't have to go reinvent the wheel, folks. This is what you're going to need if you're going to get involved in medical billing or medical revenue cycle management. You'll spend more money trying to go do it all on your own. We've got all the tools here, and that's what we want to be able to dive into. I mean, Patrick, if we just look at this here, I know that it's a plethora of information that can get out to the doctors and help get licensees, their doctors, and then help doctors get turned around.
All right, hold on. Let me look up plethora here. That's a big word. I don't know what that means. It means a lot.
A whole bunch.
First, let me address this term ABS. That's us, of course, American Business Systems. We refer to our licensees. It's kind of like a franchise, folks. You would refer to a franchisee, somebody who bought a franchise, as a franchisee. Well, when you license to use our system and our training and our support, et cetera, by paying the licensing fee, you become a licensee. So that's all that term means. You could refer to it as an affiliate or some other word if you wanted to. But when you get involved with ABS and go through our live training here in Dallas, once you graduate and you're certified as a medical revenue manager, all of a sudden you become a thriving ABS licensee because of some of the things that we've developed for you that you don't have to develop on your own. Could you start a medical billing business on your own? Say yes. You know, yes, you could, right? If you went to college, if you took some courses about medical billing, coding, et cetera, there's lots of stuff. Eric, I just got in the mail today. I sent off for the information about how to become a medical biller, and there's a big, system of courses that you can take with lots of money involved, of course, to become that. Once you do, all you can do is go get a job at a doctor's office. Right. It's not to start your own business. That's the difference.
Yeah. So, folks, to begin as a thriving ABS licensee, it literally begins with the training. Patrick just mentioned this training. Patrick, I know that we've done webinars on the training, and we kind of go through every day what kind of happens in this training, but there are a lot of companies that don't do live training. I want you to talk about the importance of, at least in our industry, why it's important to have this type of live training.
Yeah, well, one thing, I don't think we're illustrating it in these particular photographs, but in others you'll see that we bring in laptops into the classroom and set them right in front of you, starting with day one. And by the end of the first day, you've actually done medical billing. It's not a difficult thing to learn, folks. People will make you think that it is. However, there are companies who don't have live training, and what happens is they try to get on the phone with you and they read a script. That's their training, right? And you can ask some questions if you want to, but you have about 30 minutes, and then you got to get off the phone and get another call next week. That's not the way to do it. What we do is we give you a mini MBA in medical billing in 1 week's time, concentrated in 5 full days. And, man, these are full days, aren't they, Eric?
They are.
8 to 5 or 5:30 or so each day, and they're taught by people who actually are running one of these businesses. They're a licensee of ours that have been trained and certified to do the training. And so, well, in fact, I'm looking at the picture. That's you up there, Eric. You're one of those certified people as well. And then there's Cynthia down at the bottom there. She's one of our licensees, been with us for about 8 years. So we bring in people and pay those people to do the training because we want you to learn from somebody who's actually out there doing it. These days go by so quickly, you'll look at your watch and say, it cannot be 5:30. That's impossible.
Absolutely.
But we cram in a lot of information those 5 days, that's for sure.
Right. There's a couple other questions here. We'll just kind of Ron, you've got some great questions. We're going to answer some of those questions. And let me remind everybody else, because there's some other questions there, but for those that are on the call today, this is a great opportunity for you to ask any questions to Patrick or me during this live webinar, you may ask a question that someone else wished they would have asked. So don't hesitate by not putting some information up there. We'll get as many as that we can. And folks, go ahead.
Ron was saying he laughed at something we said there, probably about that word I was looking up. But Ron, you've also asked a good question there about do we just service doctors? No, when you're trained as an ABS licensee, you can service any type of medical provider that's out there. There's hundreds of specialties that are out there. And if you're specifically talking about hospitals and healthcare groups and so forth, yes, we have doctors groups that sign up with our licensees as well. And we can show you how to do the facility billing, the dental billing, all that is now included in the ABS package. We don't make a big deal out of that because your primary focus is the private practice.
Right.
So, rule number 1, turn off your cell phone. Okay, but anyway, we'll teach you to do it all. If that's what you want to do, we can teach you to do anything. Yeah.
Yep, absolutely. And again, folks, it's with all of our different services, and we're adding services, as Patrick said. We will be in the next couple of months and going into 2017, we're adding some dental billing. A lot of people have asked about dental billing. We're actually going to be doing some facility billing. Those are going to be some new services. So, folks, as you're going to see here, you're going to continue to keep growing with us. You won't have to pay anything extra once you've made your payment. So those that are getting into the training this year and we add new services next year, you won't have to pay anything extra to get those services. Now, I think one of the things that you maybe mentioned earlier, or you maybe mentioned on last week's, we do know that after the first of the year, we're actually going to go up on the fee here to get involved, the investment here. But folks, if you get in now, you'll be able to get those there in the future without any extra cost.
Yeah, now that just sounded to me like, we were trying to get people to make a decision and get their money in before the price goes up and so forth. But folks, we have not raised the price. The license fee has been the same, $24,990 for at least 6 years. So
right.
It is time for us to go up because we've added new services and we are bringing in some new things that we would tell you about it, but we'd have to kill you at this point. They're new stuff and you're going to love it. And so we are going up on the price sometime after the first of the year. We haven't set the exact time and even the amount, but just be aware that it's going up. We wanted to say that so that you can't ever come back to us later on and say, well, you never told me it was going to go up. It is going up. It really is.
Yeah.
Soon after the first.
Yeah, at sometime after the first. But again, as we add on new services, those that are already current licensees will already be grandfathered in any of our new services.
Right.
And one of the new services that we've added here, even over the last 5 years, is what we call this ABS Key Advantage. And that is everything, as you'll see here in one of the slides a little bit later, it's really the only medical billing revenue cycle management system that has all 4 of these components in it. Patrick, you want to kind of explain what we're talking about here about all these 4 components that we're looking at here?
Yeah, folks, when you talk to a company that has put something together similar to what we have, there's not many folks out there doing what we do, but just be sure and ask them this. Are all of the software pieces totally integrated? That is, are they written by the same programmers? That's a good way to put it. Because what companies will try to do is they'll have a medical billing practice management system like you see here, iClaim, that's ours. And then they'll have an electronic medical record system like our EMRX. And that's by another company, but they somehow behind the scenes kind of, with baling wire and bubble gum, kind of put those 2 together. They're not written by the same programmers. And then, of course, the clearinghouse. Eric, we're the only company that I know of that has a built-in clearinghouse. That's the claim scrubber and the submissions of the claims to the insurers. We have that built into our system. It's an integral part of our system. And the ABS system also has a patient portal that's out of this world. It's the best I've ever seen, Eric. And my own doctor has a patient portal that I've gone into, and it's pathetic, really, compared to ours. It doesn't have near the features. Ours has got, what do they call it? Telemedicine, where you can connect.
Telemedicine, yeah, that actually goes back in between these 2 right here. That works in hand right there. A lot of people ask about telemedicine, so folks, as you can see here, we've got some very key components that allow us to do something. Patrick, I think there's a business opportunity out there that's selling nothing but a telemedicine platform. But
Yeah,
yet here we've got everything involved in
yeah,
one.
yeah. How come you tell us about that? Yeah. So, folks, that is not. Well, it is a big deal. It is probably the future. We're going to see doctors electronically, virtually, I should say, and eventually we'll probably have virtual goggles that we put on, and the doctor can examine us from all sides. But for now, it's just a video chat like Eric and I are doing right here. You're sitting talking to the doctor, and then they can bill for that. In some states, it's growing.
Absolutely, it's growing. And I put this number one down here. Folks, this is the number one differentiator that we have over anybody else out there. And again, this is what's making us help get doctors. Now, Ron, you've got a question, and I want to address that here because this is interesting that you say that. As far as California businesses, how is it being for exiting businesses here? There's not many businesses from here that are actually that are doing with ABS that are actually exiting California. Patrick's going to be interviewing a young lady that's there in California that came to training just, gosh, what was it? The training after last.
Yeah, September. Yeah.
September. She's already got 3 new clients. So, Ron, nobody's leaving California. Matter of fact, if you want to stay there, obviously you can stay there. But it's an incredible business opportunity for everyone. And I know we kind of talked a little bit about iClaim in and of itself, but basically what this is, folks, this is the engine that runs everything else because iClaim is the medical billing platform and what's called the practice management system. Patrick, you want to kind of explain a little bit more from there, and I'll actually show some more screenshots of iClaim here in just a second.
Yeah, so this is the component that you would be using, and this is what we teach you in that class. When we bring in the laptops, you're actually logging into our iClaim practice management system to do the billing. And so you manage everything within that. It has a scheduler built in that you can give access to the doctor and his staff or her staff. And it has all kinds of neat features in there, but that's primarily what doctors use to run their practice is a piece of software like this. Ours is cloud-based, which means they don't have any software that resides on their computer. It's all in the cloud, and all they're doing is just logging in through any computer that has an internet connection.
Carlos says, Patrick, absolutely. Telemedicine is absolutely the future.
Yeah, no doubt about it. It's going to be big because you don't have to get in your car. You don't have to go see the doctor. It's all just done virtually over the internet like this, and then the doctor just bills you for it. He can even do e-prescribing right there across. So when you go to the drugstore, your prescription's ready to go. He can tell you to open your mouth, I guess, and look in you. And just get right close up to the camera there so he can see in your throat. I don't know how that's going to work.
I don't either. But iClaim, again, is tied in directly with the electronic medical record system, which ours is called EMRX. And as you can see here, folks, this is something that the doctor, instead of using the old pen and paper and the big old manila folder, the doctor can now use a computer system and, more importantly, really a tablet or a laptop, Patrick, to see their patients and chart everything out here.
No, the doctors absolutely love this, folks. I don't actually have it running here, but everybody's seen an iPad, of course, and it's just basically something the doctor can just carry in while they're seeing the patient. They're actually tapping on the screen, like you see there. That middle image is the iPad there. But it runs on any tablet, too. Windows-based tablets, Windows-based computers, Macintosh computers, Apple. It doesn't matter. It's platform agnostic.
Yeah, it doesn't matter which platform, Windows, Apple's, it doesn't matter. It will absolutely run. Now, Patrick, I know that we wanted to, we in that first shot that we showed there, we had all these different services, and a lot of people get a little bit nervous about getting into medical billing because they feel like they have to be a coder. You want to explain why they don't have to be a coder using CodeWrite?
Yes, but can I speak real fast? Because it's 30 minutes into the webinar, and we have a lot to cover. Okay, so CodeWrite, here it is. You can read the screen there. In fact, hey, let's point out, Eric, that in the handout section of the GoToWebinar, we already have the slides. These slides are in a PDF that you can download right now in that handouts section. Okay, so you can read this later, but basically, folks, the reason you don't need to know anything about the codes is, first of all, the doctors provide the codes to you, and if they don't know what the codes are, this service that you can offer to the doctors is performed by our certified medical coders who've been through training and know all the codes. and can help the doctor choose the right codes. With the right codes, the doctor gets reimbursed the way they deserve to be. Some of them are undercoding and losing 30% of their revenue because of that. So
Yeah.
that's what this does. Yeah. Audit
And then
guard.
audit guard. Yeah. Go ahead.
Similar to that, kind of tied in with it. Every doctor that sees Medicare patients are under the microscope of Medicare. They can come in anytime they want to and audit that practice. And if they find one little thing wrong with the codes that they've been using, they can fine them up to $10,000 per infraction. That would hit your pocketbook pretty fast, wouldn't it? And again, our certified medical coders are actually doing this service for you, for the doctor. Now, the doctor pays a fee for that. You make a few dollars on that service, but the main thing is that you have it available to you, and therefore you didn't have to know anything about all those thousands of medical codes out there.
In Quick Collect, what it does is, and we're going to get into this a little bit more detail, so that's why we're just kind of showing you a few of these, because we want to kind of showcase all of our different services. So imagine, folks, that if you're trying to go start your own medical billing company by yourself, you would have to have all of these different suites of services already. But the Quick Collect and the other one that we're going to show you here, we're actually going to tie a little bit of that more towards the book that Patrick and Dr. Vicki Rackner just wrote here just recently. But we wanted to show the case because someone just asked me, am I going to be doing collections? Folks, you're not literally doing collections. We have a service that will actually do the collections on the front end, as you can see here with Quick Collect. And then with Choice Pay, this gives people, patients some time to pay their doctor bills, maybe over time, some of their higher deductibles that they need to pay. Especially it helps out with cash pay patients there. You can see it can pay their balances over a few months automatically. So that's what Choice Pay will.
Right, and again, these are integrated within our system. So within iClaim, the Quick Collect system works to collect the money from patients that, they're not paying. Sometimes they don't pay, but we can go after them with a series of letters. Again, you're not doing anything to pick up the phone and have to call and talk to anybody.
Yeah. And I know, Patrick, you like this one because we actually use this one at our own offices, the iDocs now.
Yeah, so all those documents that the doctor currently has, you can have those uploaded into a cloud-based system called iDocs Now that, yes, is HIPAA compliant, conforms with all the privacy rules and regulations that the government has, and it takes away all of that paperwork and allows the doctor to access those documents anywhere, anytime, 24/7 from any device that accesses the internet. It's a fantastic system. You'll love it when you see it. And by the way, that's why you won't be dealing with any paper yourself running your medical billing business, because it's all done through electronic documents.
And as we kind of wrap up, these are all the things that you're going to learn during that week of training. That's what we started with. It all begins with the week of training. You're going to learn all of these different services. And one of the great things that you're going to do is learn how to do a practice analysis. And Patrick just mentioned that to you just a moment ago. What is a practice analysis, Patrick?
Well, this is something we've come up with over the last 22 years, tweaking and honing the questions that you can ask the doctor's office manager, or sometimes the doctor themselves, to get a feel for where they're at. It's actually expanded now into like 3 pages, and it goes into detail, finding out where they have some leaks in their cash flow. And it helps you create what we call a revenue report to take back to the doctor in what you're seeing here, which is a nice proposal folder, and we've got all that templated, so all you do is just fill in the blanks, put in the pricing that you want, and boom, it's all done for you. And we'll review that for you, of course, to let you know whether or not you're leaving money on the table.
And so now I think what we're going to do is spend the rest of the 20 minutes or so really honing down on one specific area, and that is getting the client. Now, Patrick, I know that you're excited because this is something you poured, I guess almost the last year into, along with Dr. Vicki Rackner, and that is this brand new book called The New Thriving Medical Practice, which kind of ties in with what we were saying about the new thriving ABS licensee, because if we can make them get a client, they're thriving along as with the doctors.
Yeah, and so, folks, let me put it this way. The reason Dr. Rackner and I wrote the book is because as a retired general surgeon, saw thousands of patients and actually outsourced her billing. She knows the advantages of that, and so she wanted to help doctors who are struggling to stay in private practice stay in private practice. And so this book is actually solving these problems for doctors. Eric, the lady that I'm going to interview, I think it's next week that I interview Jennifer, who came through in September that you mentioned. She's actually used this book by folks. Let me hold this up just so people can see. I didn't have a picture of it there to put in our slides, but those of you who are live on the webinar can see that we actually go through in the class and show you how to mark up the book. So as you can see, we highlight certain things in certain pages, just a little sentence or a paragraph, and then we stick a little sticky note on there. So when you give this out as a marketing tool for yourself to the doctor, it's already pre-marked, and the doctors go, I wonder what this is, and they start reading those highlighted things. So what we're doing is we're educating the doctor and positioning you as the expert that knows how to solve their cash flow problems. You're the only medical billing company, believe me, that has this tool. You can buy these, even though it's on Amazon for $24.95. You buy them at our printing cost, which is about $4 a copy. It's a great business card handout. And there's some topics that Eric had on the screen there.
Yeah, let's look at those real quickly. I mean, find the sweet spot and become remarkable. How to find out what your patients really wants. Finding the leaks of your cash flows immediately. And all those different areas that Patrick had listed, we're going to kind of go through a few of those and how our services that we currently have, you'll be able to use those services right along with, discovering what the problem is. So it's amazing.
Jennifer actually took this book. She says she gave this book to 3 different doctors.
Yes.
Marked up like we taught her in the class. They called her up, each one of them, in the next day or two. They called her up and said, can you come talk to me and do that practice analysis that's mentioned in the book? And they all 3 signed up with her, too.
All 3.
She's batting 100% so far. So we know that this works, and nobody else has this, folks, but our ABS licensees. That's because we just came out with it. It just was published a couple of months ago.
Yeah. So those that are a little bit afraid of marketing, if you knew that you could have something like what Patrick just showed you with all those little tabs there, and you just went around passing those out, that's what she did. She passed it out to one doctor she knew because it was her own doctor, and then she got referrals. She passed out those books to those doctors and got all 3 of them. It's unbelievable. Now here's one of the things, Patrick, that you have highlighted here on the screen and some of the issues that doctors are facing with.
Yeah, so that's one of the things that we highlight. When the doctor reads that, we're just highlighting just that topic that you see there. But as you can see, it then goes ahead and lists the things that he's probably having challenges with, and he will identify, believe me, with a lot of these, if not all of them. And as Eric will show you here on the next screen, we actually have ways of solving those problems, each one of those problems. For example, a doctor might have empty waiting rooms. How do we get more patients in to see the doctor? If they're struggling to see more patients, we can show them how to get that waiting room full through a marketing program that we have for the doctor. Lost patients, we can get those back in. The doctor might have problems with no-shows. We can solve that with our automated follow-up system and appointment reminders. Excessive write-offs, that means at the end of the year the doctor's writing off all the money that he didn't collect from the insurance companies. We can solve that by getting that from a 35 or 34% rejection rate down to 2%. And then this one here, Eric, this was fantastic when it first came out. I couldn't even believe that we could do this in real time.
And folks, what he's saying is here is that imagine in real time in our iClaim platform, that platform will actually check insurance eligibility in real time and let the staff know and the doctor know before that patient leaves as to whether or not their insurance is valid. You talk about that alone, Patrick, right there, could increase that doctor's pay in the double digits, and 15 to 20%, just doing that alone.
Because think about it, folks. If a doctor sees a patient that's not covered by their insurance, he spent that time and doesn't get paid for it. That's very costly. He could be seeing 3 or 4 dozen patients a month that were. So this checks their eligibility by going to in real time, to the insurance company's database for that patient and looking and making sure that that patient is eligible for that coverage on that visit. It's fantastic.
Yeah, so I just went back one screen again, Patrick. So these are the things that, I mean, we list out. There's that no-show, there's loss of payments, excessive write-offs, failure to check out insurance eligibility, failure to double-check and update patient information, failure to check eligibility. So these are the issues that you and Dr. Vicky really honed on as the critical cash gaps.
It's 4:42. I'm just throwing that out. Okay.
We got plenty of time. We're ready to go. All right, because we're going to go through the rest of these pretty quickly and now you're talking about rejections. Rejections of what, Patrick?
Yeah, it's the claims that are sent into insurance companies that they reject and send back. Most offices don't take the time to find out what's wrong with that denial and go back and send it back through. So the doctor ends up writing that off at the end of the year. We can bring that down from the nationwide average of 35% down to less than 2%. Our system, folks, nationwide has a first pass rejection rate of only 2%. Yep. That means more money in the doctor's pocket. They love this part when they see it on the report that you present to them in your proposal.
Absolutely.
Go, wow, you can bring me another $30,000, $40,000 this year? Let's give us a try.
Yeah, of course. So you can see, the AAPC actually said that. Then some common causes for rejections. Some of these include, again, billing for procedures not covered. Our system checks for that. Inaccurate coding. Our system checks for that. Undercoding. Our system checks for that. And human error. Our system checks for every one of these automatically.
So you're saying that our system checks for things?
Yes.
Okay.
Every one of these. It makes sure that you can't even process a claim without it making sure that these things are not taken care of.
Oh, my goodness. Rhonda's worried that she has already got her paperwork going, working with her coach here at ABS, and she's worried about that price increase. Rhonda, as long as you're working on that right now, we will lock that in. Don't worry about that price increase. We didn't mean to give you some anxiety over that. And Ron, if you're having problems putting your money together and don't think you can even do that until maybe, the first or second quarter of next year, don't worry about that either. You should get with your ABS coach and let us work with you on whatever challenges you're having there of getting your finances together.
Another part that you kind of got highlighted here is from a cash smart standpoint. We believe that outsourcing is more cost effective than hiring employees to do the work.
Yeah, and of course that's me as what's that?
All I was saying is that a lot of people are worried that how can I get the doctor's business if they've already got people in their office doing the billing?
Oh yeah. And that's funny because we've never really had a problem with that. Licensees just basically help the doctor figure out how to reallocate the time of his current staff. Because folks, if we could free them up from the details of doing the medical billing, guess what? They can help the doctor see more patients. And of course that brings more revenue. So yeah, here's a great quote here from the blackbookrankings.com. All the physicians' practices that have employed billing staff, they're doing the billing themselves, 42% of them hope to outsource their billing in the next 12 months. Eric, I'd say that this is a good business and a good time to be in the healthcare field.
Absolutely. No doubt about it. Now, what about this cloud-based claims filing? More secured, as you say here in the book.
Cloud-based claims filing is more secure. Well, a lot of people don't realize that today the cloud is just everywhere, right? Apple has it, Google has it, Yahoo has it. Everybody now is working in the cloud because it makes more sense to store all your data on secure servers that are far more secure than you could ever have in your own home or in an office somewhere or even in the doctor's office. Because if that computer gets stolen, all that patient data is out there in La La Land, right, that anybody has access to. So there are great reasons why the doctor should be using a cloud-based system, and most of them aren't. So we wanted to cover that in the book so that they know that when they deal with you and ask you to do the practice analysis, you can say, I have a cloud-based system.
Yep. And again, our system takes care of all of these needs. It's secure. it's HIP compliant, and so when you're addressing your doctors, you're going to find out that you have all of the needs, you got all of the solutions taken care of. Again, we wanted to really re-illustrate this back to you. Again, that our system is in the cloud, or it's what a lot of people used to call it software as a service.
That's right, software as a service. Yeah. Hey, Ray says, will this program support clinics that are owned and run by nurse practitioners under full practice states? I'm not sure I know what that means, full practice states, but anyway, the answer is yes. Yes.
All right, we're just about to wrap up here with this, just a couple more of the highlighted areas I know you wanted to kind of go over. And this one says that doctors commonly just accept that they have to bear the burden of extending credit. I guess that's one of those areas where the patients are just not paying the doctor.
Yeah, so here's the point, guys. We have you highlight a lot of stuff that are a lot of good things. Hey, and by the way, Eric, wouldn't it be nice if all the people on the webinar today had this book?
Yep.
Then they could read all this stuff for themselves. All right, so we're going to show you guys how to get a copy of this at the end of the webinar.
Because Steve asked, hey, how can I get a copy of this book? Well, Steve, we're about to show that to you here in just a moment.
There you go. Hey, you can go to Amazon and order it for $24.95, but don't do that. We're going to give you an electronic copy of it, yeah. All right, so Eric, I think this one solves the problem that we had highlighted on the previous slide, right?
Yep.
Choice pay is one of those things that basically, folks, it gives the doctor the ability to let the patient choose how they pay it out. And now we're on Quick Collect. And this is the one we mentioned earlier, that you never send any patients to collections. This does it all internally within the system, and it increases the patient retention. It's 2 times the average recurring of funds, and it's web-based and it's detailed reporting. There. Hey, you can find out more about all of these by going to our website or talking to your ABS coach. The person who sent you the email to come to this webinar is your coach. Now, if you don't know who that is, call us. We'll give you the number here in a minute, and you can find out who that is. So there's one of the reports that you'll get out of Quick Collect showing the difference between it and typical collection agency results.
And Patrick, I think it's just the last. This is the last one because it summarizes everything up here. And you basically say, to the doctor, you and your staff, you've been trained to provide medical care for your patients, not all the bookkeeping functions. And this just kind of just brings it all together. That really, what we're trying to let the doctors know, and the doctors already know this: get the billing out of your office, get it out of there, and let someone else deal with it because they know what they're doing.
So think about it, folks. We're giving you a tool that does all the selling for you. We are selling the doctor as they read this book on the need for you. That's why these doctors called Jennifer up and said, hey, come tell us about this. She didn't have to do any selling. That's what's great about having a tool like this, and only ABS licensees have that tool.
Yeah. And so you yourself can join the rest of the licensees that are starting to really thrive by utilizing this book, utilizing the new services that we have coming up, whether it's the facility billing, whether it's some of the other aspects of what we're going to be doing. And what's really cool about this is you've got this up here, and it's pretty interesting. If everybody can see right down at the bottom, I'm going to circle this down here as you talk about this, Patrick. You're an author, maybe he's an author, but...
Or you can go to the next slide, and I pointed out right there. On the next slide. I added this, and Eric didn't know I added it, sorry. But I zoomed in and showed people that we can actually put your name on the front cover. Now, folks, this is brand new. Not even our existing licensees know about this, so if it gets out to our existing licensees, I'll deny it, Eric, because this is in beta. This is what's called beta, but we have figured out how to print copies of the book, small quantities, with your name on the front cover, having written the foreword to the book. That's spelled wrong. We know that. Forward. Do you know that forward is spelled wrong? It's F-O-R-E-W-O-R-D. Well, anyway, then the forward, this is spelled correctly, is actually 2 pages that we've written that as if it's from you. And look, your contact information will be there at the end of that second page of the forward. Imagine, Eric, now they have a business card that they can give to a doctor that has their contact information printed right inside of it. That is worth thousands of dollars. I'd say at least $5,000. Wouldn't you? But by itself, to make you a co-author with a doctor and with me. And of course, now that's going to be a part of our package, and that's one of the reasons we're going up on the price. But again, folks, if you get involved in this and can come to the training this December, or at least in January, you're going to have all this as a part of that. That'll be part of it. You're not going to pay extra for that. But existing licenses probably will.
Now, this is Jennifer Boyd. Jennifer Boyd is the young lady that actually took this book. This is the one that you were talking about, Patrick. She took that book to 3 different doctors, and she's batting 1,000 here.
That's her getting certified at the end of our training workshop in September. This is November the 9th. That was a couple of months ago. She's got 3 clients. Yeah. We got to go up on the price.
So next week's interview is going to be with Jennifer here. And folks, what we're going to do for the last about 7 minutes here, we got about that. We're going to get ready to start answering some more of your questions. But as we do that, we just want to kind of show you again, just bring it all back together to let you know that as an ABS licensee, you not only get this, but any new services that we have coming up. Now, Patrick, let's take a little bit of time here and maybe go back through some of the questions that we may have skipped over or want some more that we need to kind of go over here. So let's see. You answered Rhonda's question. Poor girl, she was probably worried about making sure that gets locked in there. So Rhonda, I think you're going to be okay there.
Yeah. Ron said Android as well. I guess when we were talking about the different platforms, yes, Ron, it runs on anything. Chrome, Internet Explorer, Firefox, Safari, it doesn't really matter. As long as you have an internet connection, you can run our system. Yeah. And nothing resides on the computer. So you can actually go to, if your computer crashed, and you can go to your neighbors and use their computer and just log in and start doing the billing from there. Yeah.
Yeah. Let's see. I think you answered Ray's about will this program support clinics owned and run by nurse practitioners under full practice states. Yes, Ray, I think I understand what you're meaning now. There are some clinics that are owned and run by nurse practitioners, and so as long as they're independent and as long as they're billing out on what's called a CMS 1500 form, there won't be any problems with that whatsoever.
Hey, Eric, can you put the guarantee on the screen there? I want to kind of talk about that real quick. In conjunction with Ron, you originally asked about the failure rate, the success rate, and so forth. This is one of the reasons we came up with this 100% money-back guarantee. And, folks, there are no weasel words in this guarantee. I mean, I tried to write this as straightforward as I could. Look, here's what it says in the agreement that you sign when you become a licensee. If at the end of the training workshop, for any reason, Eric, any reason, you do not think this business is right for you, that could be anything, right? You could say, you know what, I don't like Eric's, the way he dresses. It doesn't matter what the reason is, any reason. Simply tell any staff member. You don't even have to tell me directly. Just go to any staff member and say, I want my money back. And we'll make sure that you get your money back. Folks, we want people who are out there actually running the business and believe that this is something that they can do and that it's something they can make money at. Otherwise, we don't want your license fee. We'll give it all back to you. Now, you would be out what you paid to get down here to Texas, maybe your airline flight, and the hotel. What, $1,000 maybe, Eric, they might spend to come down here and figure out whether this is for real or not. I don't know of any other company that would offer this because we reveal a lot of stuff in that week's time, all kinds of proprietary information. Hundreds of handouts are given out, and big, thick manual for training, books, all kinds of stuff. And we still will let you get your money back at the end of the week if you don't think that it's right for you.